Hello everyone, my name is Lizina Moharzan. Today I am going to present the presentation on one of the contemporary nursing issue, that is nurse to patient ratio. Nurse to patient ratio refers to the number of nurse assigned to the patient. Nurse patient ratio greatly affects patient safety and healthy workplace environment. It reduces the quality of patient care. When the single nurse is assigned to too many patients, he or she will have the high workloads and experience interruptions, distractions, and cannot focus properly on the tasks. This creates poor and high stress environment for nurses to work. The lower nurse staffing ratios are linked to patient fall or injury, mortality, infections, and medication error. According to the research, there is the high chances of patient fall when there will be the minimal nurse in the ward and the patient are on or off to bed. Similarly, due to the lower nursing staff, the nurses face distractions in their work and make several mistakes, mostly medication error, which may cause patient harm. Currently is being done about the problem. The number of nurses on a shift plays an important role in patient safety and quality of care. So the Queensland government has legislated minimum nurse to patient ratios in the public health facilities to reduce the workload, improve patient safety and quality of care. The government has recommended 1:4 nurse to patient ratio in the morning and night and 1:7 nurse to patient ratio for night. The lower nurses to patients provide safe, less workload, staff satisfaction, and workforce sustainability. It also provides patient satisfaction and improve patient outcomes by reducing the readmission rates and mortality rates. Why it is a significant issue to contemporary nursing practice? The nurse to patient ratio is a significant issue in the contemporary nursing practice because it negatively impacts on the patient outcomes and healthy environment, which has become a major focus in the healthcare setting. In the healthcare facilities, there should be a minimum nurse to patient ratio for the patient safety and high care quality. The lower nurse staffing ratio affects the nurses' work performances. According to the research, the average length of stay in acute general hospital is 4.6 days, due to which patient turnover is rapid. This increases the nurses' workload when they need to involve in the process of admission and discharge of the patient. At this time, the nurses cannot provide quality of care to the other assigned patient. The nurses need to work in a very stressful environment as they need to rush in order to complete all the work during this shift. This results to nurses' dissatisfaction from the job, fatigue, stress, injury, and burnout. The nurses working in such situations are more likely to make mistakes, mainly medication error, and also linked to patient fall, mortality, and infections. Therefore, the lower nurse staffing ratio leads to the missed patient care and affects patient safety. How effective leadership mitigate this problem? As the healthcare is facing the effect of nurse to patient ratio, the effective leadership plays the important role in managing the nursing ratio and creating healthy work environment. The nurse manager uses the leadership style in the hospital. The nurse manager has the skill to think critically, handle the stress, and inspire the staff to work together and achieve a goal to provide best patient care. In the low nurse staffing environment, the nurse manager's role of helping and supporting the staff in the work makes a strong relationship with each other. This increases the job satisfaction for the nurses and reduces the level of stress and workload. Therefore, the nurse manager leadership helps to provide the high quality of care to the patient and create healthy working environment. Background of the issue of nurse to patient ratio. Nurse to patient ratio has become a worldwide issue. The high number of patients assigned to the single nurse affects in the patient care and working environment. The lower nursing staff creates a very stressful environment for the nurses, which leads to the worst patient outcomes associated with high patient fall, mortality, infection, and medication error. According to the research estimated by the nurse, the fall rate is 67.2 percentage, pressure ulcer is 77 percentage, administrating wrong dose is 43.7 percentage, administrating wrong drug is 52.3 percentage, and bloodstream infection is 77 percentage. Therefore, the nurse staffing ratio is badly affecting on the patient's care. The workload and distraction is contributing to the missed patient care. The nurses need to rush to complete their work and cannot give enough time to all the patient. Moreover, when the patient discharged, the nurses should provide the patient and family education about how to care the health condition after discharge. But due to the low nursing staff, the nurses doesn't have enough time for the patient and family education. The nurses working in such poor environment reported that 50.8% leads to high job burnout, 47.9% to job dissatisfaction, and 23.5% leads to intent to job. The research shows that when nursing ratios are favorable, the nurse and patient outcomes are more favorable. The nurses can remain more focused in their work and perform best practice. As a new graduate nurse, when it comes to dealing with nurse to patient ratio, what are my responsibilities? As a new graduate nurse, working in the low staffing environment is very challenging. The nurses can suffer from stress, anxiety, depression, job dissatisfaction, and burnout and intend to leave. But I will manage and reduce the stress by following an MBA nursing code of conduct, which is very important in nursing. The patients trust on the care provided by the nurses, so the nurses should know how to provide high quality of care to them in every situation. Working in the stressful environment, there may be the high chances of occurring errors, more likely medication error. So, in order to reduce error by following the code of conduct, I will practice safely by collaborating with my team. I will notify the nurse manager leader about the low staff on the floor and ask kindly to stay with my other assigned patient while I'm doing the medication. When administering the medication, I will follow the 5 rights, that is right patient, right medication, right dose, right route, and right time. This helps to minimize the error and provide patient safety. It will always be very helpful for the new graduate nurses to take help from the senior staff than to make any error. The new graduate nurse can learn many things from them, like the time management skill to work in low staffing environment, etc. Moreover, when the nurse is assigned to too many patients, they are unable to provide high quality care to all the patients. In that situation, I think I will think critically and involve in the decision making. I will divide my tasks into high and low importance and do the most important one first and order at last. Moreover, I will involve the family in the patient care if they wish to, which helps to minimize the workload. The lower nursing ratios leads to the patient dissatisfaction. They feel like the nurses are not caring for them and the nurses may lose the patient trust. So even if I am in hurry, I will smile and greet the patient to make the patient happy. The aim of the presentation. The aim of the presentation is to aware the undergraduate nurse, student, my peers aware about the significant issue of nurse to patient ratio in the contemporary nursing practice. How communicating information about this topic supports effective leadership. The communicating information about the nurse to patient ratio supports effective leadership because it gives the future nurses the idea to cope with the stressful environment. Also, it helps to become a leader in their own profession. Furthermore, it motivates the future student to follow the nursing standards in order to prevent different kind of error in their practice. Thank you.